Today we're talking about fibromyalgia, and we have some very special guests today that I'm excited to introduce to you. First, Dr. Dave Williams. He's a professor of anesthesiology, medicine, psychiatry, and psychology, and he is also the associate director of the Chronic Pain and Fatigue Center at the University of Michigan. Welcome, Doctor.
Thank you, Lynn.
I'm so pleased to have Dr. Williams because he's been studying fibromyalgia and chronic pain for many years and is a very important person in the study of fibromyalgia. And so I'd first like to ask you, what is fibromyalgia?
Well, fibromyalgia is a chronic pain condition, and it tends to occur in women more frequently than in men. In women, it's about 3.5%. In men, it's only about 0.5%. Fibromyalgia tends to occur in midlife, 30s and 40s for most folks. And fortunately, it's not life-threatening, but it can certainly interfere profoundly with people's quality of life over time. Fibromyalgia is widespread pain, so it differs from most forms of pain, which maybe just are located in the knee or the head or low back. Fibromyalgia is widespread and it occurs all over the body, and it can also kind of travel to different locations on different days. Fibromyalgia also tends to have other symptoms like profound fatigue, memory problems, trouble thinking, sleep problems, waking up feeling like you haven't got a good night's sleep, and sometimes moods like anxiety or depression go along with fibromyalgia.
Obviously, it's not something that people are able to deal with in a way that is easy for them because it is very challenging. And so I'm curious because I know sometimes people feel good one day and they don't feel good another day. You know, how come that happens, and why do we have to deal with this when it's waxing and waning? Why can't we just, move forward and have it continue to get better and better?
Well, fibromyalgia is a type of pain that is very much related to what is going on inside of the body at the time, but not just the sensations coming from the periphery, but also in terms of your emotions, your thinking, any stress levels you might have, your memories, things you've experienced in the past. All those things go into the perception of pain. And so as your day changes and the things that you're doing during the day change, that will have a different impact on how much pain you feel that day.
So it could be very difficult for a doctor to understand and diagnose this illness because it does change.
It does change, and I think we're learning a lot more about fibromyalgia. There are certainly still some medical reports that will say that we don't understand fibromyalgia, we don't know what it is, but I think we can do better than that. I think that we are learning a lot about fibromyalgia. We've done research on it for over 30 years now, and I think we know as much about fibromyalgia as we do most other forms of chronic pain. There's also a number of studies now where we're using fibromyalgia as the model for understanding other forms of chronic pain as we're trying to understand and do research in chronic pain more generally.
If you were talking to someone's spouse or someone that maybe doesn't understand fibromyalgia, how would you explain it to them? Is there a way you could give them an analogy or something to help them understand?
Well, sure. I mean, most forms of chronic pain have a one-to-one relationship with tissue damage. And, if you cut your hand or you crush your finger in a door or something like that, you're going to experience pain, and then it will heal and it will go away. Fibromyalgia is not quite like that. Fibromyalgia is a problem with how the central nervous system actually produces pain or generates pain. So it's not necessarily associated with a specific tissue damage. It is associated with how information comes in from the periphery, from your finger, your leg, or whatever, and then is processed as pain in the central nervous system. So yes, an analogy might be something like a smoke detector, for example. When it's working properly, when there's enough smoke, the alarm goes off. And there's a one-to-one relationship between the alarm and the presence of smoke. But you can also imagine a situation where the smoke detector would go off and there wasn't any smoke. Now when that happens, you think, well, the smoke detector's broken. And so what you'd want to do is go over and look at the circuitry and fix the circuitry of the smoke detector. Well, it would make no sense to try to open the windows and turn on the fan to get rid of smoke that's not there. You'd want to focus on the alarm system and what's going wrong with the alarm system. That's the way to think about fibromyalgia as well. There may or may not be something going on in terms of tissue damage. The problem is in the circuitry of the central nervous system that creates the perception of pain, and it tends to augment things. So you may have a sensation that may not be painful to someone without fibromyalgia, but is very painful to someone with fibromyalgia because the central nervous system is augmenting that perception and turning it into pain.
I think one thing that's so interesting is that with new technology, things like functional MRI machines and things, that we can now actually see pain happening in the brain. And those things weren't possible just even a few years ago. So those things can be very much a part of the knowledge and research to learn more about this illness.
Certainly, and what we're learning from neuroimaging studies like that is that pain is composed of three components. There's the sensory component, the information coming in from the periphery, but there's also an emotional component, and there's a cognitive component, a mental component, your thoughts, and certainly a memory component that's in there as well. And you need all three of those things to form the perception of pain. Now, what's interesting is that you can also intervene with treatment at any one of those locations, at the sensory level, which is what medications many times will do, but you can intervene at the emotional level and over on the cognitive level as well. So it gives you more options and more treatment targets for treating something like fibromyalgia.
So it's very exciting because we're learning so much more about this. This will help us learn about other illnesses as well. And we're now learning ways to treat this so people can have a better quality of life.
Exactly.
Well, I want to thank you so much for being here today and sharing with us information about fibromyalgia. I know that we have a lot of other questions and patients that want to ask you questions, so
Certainly.
we'll be back and talking to you again soon.
Very good. Thank you.
Thank you, Dr. Williams.